All right, so let's go over COVID-19 and the basics and really how to keep your family safe. The intention of this webinar is to keep all webinar participants informed on COVID-19 science that'll help you and your family stay healthy during this pandemic. The outcome that we hope to achieve by this presentation is that you'll leave the webinar motivated to create an action plan for yourself and for your family. And that once you actually do that, then you'll actually be motivated to create an action plan for your broader community. So what is a pandemic? A pandemic is the worldwide spread of a new disease that must be an infectious disease and must be contagious, that people do not have immunity to. So examples are smallpox, polio, tuberculosis, HIV, bird flu, SARS, and MERS are examples that you've probably heard of. So why is it called COVID-19? I get asked this question a lot. CO is for corona, which is Latin for crown or halo. When you look at the molecule under a microscope, it actually looks like a halo or a crown is around it, which is the picture to the right. VI is virus, D is disease, and 19 is 2019, and that is the year that the strain was first clinically appearing in patients, and hence the name COVID-19. So why is this so important? We've all experienced a pandemic before. If you're over 65, you may have experienced more than one. And there's basically two final outcomes to a pandemic. Either there's a complete cure or near complete cure. So smallpox was eradicated from the world in 1980, and then polio is near complete eradication. Or there's some sort of containment or management without a vaccine. So for that, think of something like HIV. So we all know about coronavirus and its spread, and it's primarily people and surfaces. So it's small droplets from the nose and mouth of an infected person who's talking, coughing, or inhaling that land on surfaces that then we touch and actually infect ourselves. So I tell people it is very important to respect COVID-19. One, it's a droplet disease that stays on surfaces for a very long time. Porous surfaces like cardboard, it stays on for 24 hours. Plastic and metal surfaces, it stays on for 96 plus hours. So that's almost 4 days. The other thing about COVID-19 is highly contagious. So here's how we calculate how contagious something is. What is the minimum amount of time that you need to be exposed to it in order to infect others? For COVID-19, that's 45 seconds, right? Then the other thing we look at is what is the percent transmission? So if 100 people got exposed to the disease, how many people would catch it? For COVID-19, that's 60 to 80%. For something like influenza, it's 20 to 30%. So this just tells you how much more infectious COVID-19 is. Now, let's talk a little bit about being a droplet, the disease transmission. It's a droplet disease, large droplets that hit your mucous membranes. When you have something that's airborne, that's a small particle that is inhaled. The droplets are greater than 5 microns, and they fall short 3 feet from its place of origin. So as you remember, the CDC first came out and said you needed to stay 3 feet away from people. Airborne diseases land 5 to 6 feet from origin. So what's happening is COVID-19 originally was considered a droplet disease because of the size of the molecules, but it's acting a little bit more like an airborne disease. So it's acting like a combination of both. So what does this look like? Somebody stands and they cough or they sneeze, 3 feet, 6 feet away, all these particles go all up in the air. So then what you're looking at is what are all the surfaces that these particles during this distance actually land on. Then you could come back and actually interface with that surface a day later, 2 days later, and actually be exposed to COVID-19. So you want to look at highly trafficked surfaces, doorknobs, handles, debit card PIN numbers, gas station pumps are a big one. This is why the gyms were closed and need to really stay closed. Cell phones. For hospital workers, if there's any hospital workers in your household, their shoes, their scrubs. These are all surfaces that need to be paid particular attention to. and cleaned, or you wear gloves when you're interfacing with these surfaces. Now, let's talk about risk factors. The risk factors for the disease, they talk about the elderly. So I want to actually be really clear. The elderly is defined by the CDC as anybody born on or before 1955. So there's a lot of people born on or before 1955 that still go to the gym, still feel very healthy, but that is a risk factor for COVID-19. Living in a nursing home or long-term facility, anyone with asthma or emphysema or any sort of chronic lung disease, anyone with a heart disease with complications, anyone who's immunocompromised. Now, let me tell you, immunocompromised is anyone with cancer, anyone who's a transplant patient, anyone who has HIV, anyone who has lupus, sarcoid, rheumatoid arthritis, any of the autoimmune diseases. Also, any sort of underlying medical disease like diabetes, renal, or liver disease that is not well controlled. Anyone who's pregnant in general has an increased risk of a viral disease in general, but has not been listed as a COVID-19 risk factor. However, they need to be monitored more closely. The last risk factor, which is not really talked about much, is obesity. And obesity, severe obesity of any age, is a risk factor. That is defined as a BMI, or body mass index, greater than 40. So body mass index greater than 40 is someone who's 5'2" over 220, 5'6" over 250, 5'10" over 280, and 6 feet tall over 300. So you will find particularly that that is a risk factor at any age. So the other thing is that men are at higher risk for getting this disease. And then once they get it, they don't do as well with it. So they get the infection about 30% more than women do, and they have a death rate that is about 60% higher. And that is has been consistent from the Center for Disease Controls from China and also from Italy. The other thing that is a risk factor is smoking or vaping. I think that in the United States, we have about 40% of our hospitalized patients that are between 20 and 54 years old. And I think that that is primarily related to cigarette smoking and vaping. If you have one risk factor, you increase the likelihood of being in the ICU, being on a respirator, or dying by 79%. If you have two risk factors, you increase the likelihood of requiring an ICU, respirator, or dying by 250%. So it's really, really important that people with high risk factors do not actually come into contact with this particular illness. So I stress that people with risk factors really take extraordinary precautions to avoid coming into contact with COVID-19. This just actually shows, someone had asked me, are certain risk factors, are they associated with a poorer outcome than others? Cardiovascular disease is the one that actually sticks out as the one that is actually probably the worst. The other ones are not that much different from each other. Now let's talk about prevention measures. So I'm going to talk about how to prevent COVID-19, how to prevent spreading COVID-19, and then what happens if you get COVID-19. So as far as preventing COVID-19, they've all talked about hand washing, but I actually want to talk about how to properly wash your hands. So when most people wash their hands, they do what is listed there in square number 1, which is just a palm-to-palm hand washing, okay? But to properly wash your hands, you need to get in between your fingers, which is number 2, the back of your hands, which is number 3, the base of your thumbs, which is often missed, in number 4, the back of your fingers, number 5, your fingernails, number 6. Washing the hands includes your wrist, and then rinse and dry. So those are all the things that need to be done with a proper hand washing, and 20 seconds can go by fast if you actually do that properly. Now, social distancing. This is very important, especially given that we've got a couple states talking about opening back up. The way we were actually operating previously, one person in 30 days gives this infection to 406 people. Now, if 50% less exposure, then one person actually gives it to 15 people in 30 days. 75% less exposure, which is where we are now. One person gives the infection to 2.5 people in 30 days. So the impact of social distancing is very, very, very important. And I think that one of the things is if you prematurely declare victory during a pandemic, it almost guarantees you defeat. So here are some guidelines that I have in addition to the CDC guidelines. 1, do not go to the grocery store. Order your food online, order your medication online. If you have older people in your family, you want to make sure that you can help them order online or that you order for them and send it to them. When food is actually delivered to your home, whether or not it's takeout, cooked food or groceries, I spray the food outside. So the delivery person places the food on the ground. I come outside with my Clorox and spray the Clorox packaging, and I leave everything out there with the Clorox on it for about an hour or 2. Then I bring it in, I put it on the floor. You don't want to put it on the countertop because the countertop is a surface that you actually touch. You want to throw plastics and bags away as quickly as possible and put any sort of cooked food into your own Tupperware or containers. Again, cleaning any surfaces that you use a lot and cleaning them frequently. I avoid using cash. Cash is something else that actually has been, a lot of people have touched cash. When I use my credit card or my debit card, I wipe them down before and after use. I often get asked of people about getting into small groups because, people are missing birthdays. There's also different holidays, celebrations. I would avoid it at all costs. One of the things that we found is that when people get together for funerals or birthdays or any sort of celebrations, then we see this disease in family clusters. So there'll be 7 family members that got infected and 3 family members that died. So you want to sort of avoid that. People who have asthma, this is very important. You do not want to use your home nebulizer machine. When you have asthma, you cannot tell the difference between an asthma attack and a COVID-19 infection. If you have COVID-19 and you use your nebulizer and you don't know you have COVID-19, you then are aerosolizing the disease everywhere in your household. So you either want to use an inhaler with a spacer chamber, which I've actually showed pictures of here. You put 7 puffs into the spacer chamber and then you actually breathe back and forth. That delivers as much medication as a nebulizer. Or you use a nebulizer machine outside or in the garage. There is an increased risk for men related to facial hair. So mustache and beards. One thing that they found is your masks don't fit as well over when you have a mustache or beard. And then the other thing is that it is something where the virus can kind of accumulate until you get a big enough viral load. And so people with facial hair are getting large viral loads and not doing as well. So I actually suggest getting rid of facial hair till this is over. To wear a mask or not wear a mask. Many of you know we've actually been recommending wearing a mask about a month before the CDC did. And so that is what we've been recommending. A couple of do's and don'ts here about wearing a mask. Make sure that the mask covers your mouth, nose, and chin. Make sure that the metal piece is up over your nose and clamped down. Avoid touching your mask. Also avoid bringing the mask down in order to speak. That is very important. And don't leave your mask in the reach of other people. Now, there's been some research that's come out. I've gotten a lot of questions about the do-it-yourself face mask. And basically, we've come up with the best material or denim, canvas, bed sheets, and paper towels. The worst material or any sort of wool or rainy scarves. So people have always asked me what material should they make it out of, and someone actually has done a study on this, and we've put it on our website. Women who are pregnant or near delivery. If you have a normal pregnancy, you may want to consider home delivery with a midwife. They did COVID testing on the L&D nurses in the UK, and 100% of the L&D nurses were COVID positive. So you may want to consider, if you have a healthy pregnancy, doing a home delivery with a midwife. Missing your personal care services. I know some people have had, underground hair and nail salon going on. Either, they go over to the person's house or they have the person come over to their house. It's just not worth it. I really wouldn't do it. It's just not worth that risk right now. Now, let's talk about action plan. What happens if I think I have COVID-19? What are the symptoms? What do I do? So one, you can have COVID-19 and have no symptoms. A very early symptom is loss of taste or smell. Some people have GI symptoms. They have nausea, vomiting, and diarrhea. The other thing is that people are getting blood clots. They're getting blood clots in their lungs, and they're getting blood clots in their legs, so any sort of leg swelling. Then you also have the things that you hear about, which are the respiratory symptoms: headache, fever, dry cough, difficulty breathing. Then there's also what we call COVID toes, and I'm going to show you a picture of that. COVID toes are basically reddish, bluish discoloration of your toes. It looks like they might be frostbitten or something. It can occur in adults, but it particularly is common in children. So these are all the important signs and symptoms, because if you get some of these signs and symptoms, you need to quarantine for 14 days. What do I do if I think I have COVID-19? I'm still recommending that people use Tylenol as opposed to ibuprofen, Aleve, or Motrin, because the World Health Organization, their original recommendation was to avoid ibuprofen. Do not go to the hospital unless you're really, 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 really sick. A lot of people have asked me about testing. The testing guidelines vary dramatically from state to state. Ideally, we would have a consistent guideline throughout the country, and then maybe states would add on things that they want to add on. Social distancing versus quarantining. So this is important. Social distancing right now is for everyone, which is staying 6 feet away. Self-quarantining is when you actually have the symptoms of COVID-19, or you're positive, or you've been tested and you're waiting for a result. Self-quarantine is complete isolation. It is done for 14 days. So that means you're in a room by yourself, family members or someone drop food at your door, you do not come out of the room. Hopefully you have a bathroom in there. If you don't, you have to use a hallway bathroom, and hopefully no one else in the family has to use that bathroom until the 14 days is over. Some people have said, well, why don't I just go ahead and just catch it and get immunity? Well, it's not particularly a good idea. One is that this disease causes pulmonary scarring and pulmonary fibrosis. So the viral pneumonia has a 50% death rate, and that's what you're seeing, that the people that are actually dying of this disease, what they're dying of. The ones that survive, 30 to 40% of them afterwards have decreased lung capacity, and they have problems just normally walking a block or two. So this is a very treacherous disease that causes a lot of damage to the body. Then on top of it, you don't necessarily get immunity for life. So we are seeing some people now in China that have caught this for a second time. How to win against COVID-19. What is important? Early detection and early response, and what I call following universal precautions. You follow universal precautions, which is, I assume I have COVID-19, I assume you have COVID-19, you assume you have COVID-19, and you assume I have COVID-19. And then we all act accordingly. Now, let's talk about this for just a second, because this is something that is very important. We right now do not have a robust testing system in this country, and the problem with that is that asymptomatic people can actually spread COVID-19. We have 4 examples of that. On the USS Roosevelt, about 60% of the COVID-19 sailors had no symptoms. In Iceland tested the largest percentage of their population. They tested 5% of their population. They found that 50% of their positives had no symptoms. Cook County Jail also tested everyone in their jail and found similar, and so did a town in Borne, Italy. So it's been pretty consistent in the US and Italy, and also in Iceland. So if you have COVID-19 already and you have someone in the ICU, I put all of my contact information in here, but let me give you a couple of things that are really important. So one, I'm going to go over the treatments that are working and what's not working. So what's showing promising results? One is, and I needed to add this to it, one of the most promising things to do is to turn the patient over onto their belly before they're intubated or even when they're intubated. So the goal is to actually really avoid putting the patient on a ventilator, right? So we find that these patients actually get more oxygen if they're on their belly than on their back. Plasma therapy is the therapy where someone has gotten COVID-19 and then donated the antibodies. That is showing very good results. The other thing that's showing decent results is a medication by the name of remdesivir. What's not showing promising results are chloroquine and hydroxychloroquine, which the president has actually been touting. These have actually been found to not help with COVID-19, and they've been found to be dangerous. So people have been getting cardiac arrhythmias from them, and they have stopped many of the clinical protocols. The other two medications down there are HIV medications, which have not been working. This just shows one of the articles on the hydroxychloroquine. There was no benefit, and there was a higher death rate with the hydroxychloroquine that the president has been talking about. So that you want to avoid. Let's talk about some forward-thinking actions. Consider now, if you had to be quarantined, how would you do it in your home? If you got sick, do you have the over-the-counter medications that you need? Purchase them now. What mask or mask alternatives do you have in your house? You want to make sure that you have them in your pocketbook and in your car and in different places as you do go out and go wherever you may need to go. How am I going to limit my exposure to highly trafficked surfaces? What am I going to actually do? Am I going to use gloves? Am I going to have a cleanser in my car? If you're a company or a union, you've got to really look at an occupational health plan. State and local governments need to engage multidisciplinary groups of community leaders, medical professionals, and elected officials to really look at the things that they're dealing with around staffing and PPE. Have conversations with your family members and be really clear about what their wishes are about wanting to be put on a ventilator or resuscitation before anyone gets sick, right? If somebody has a specific wish, they don't want to be resuscitated or they don't want to be on a ventilator, you need to have that conversation now. Now, what's next? Continuing social distancing until we've turned the corner. If you have employment that's impacted by the social distancing that we're doing now, you want to really look for what else can you do? What else can you do remotely? What else can you do that might even be in a different industry? A vaccine is about 12 to 18 months away. They've actually started human trials in the state of Washington, in China, and also in the UK. So the human clinical trials have just gotten started. When they show some effectiveness and they have a vaccine, what normally happens in a situation like this is they actually will begin to give the vaccine to all of the essential workers first. So they'll make sure that all the grocery store clerks and physicians and nurses and EMS folks have the vaccine. And then once we all get vaccinated, then they will begin to vaccinate the general public. Stay informed and stay alert. I have a lot of these links on my website, AskDrV.us. There's also a list on EPA.gov of disinfectants that you can use. And I tell people, respect COVID-19, create a plan for yourself and your family and your community. This is just my Twitter page, what the website looks like, so you know you've gotten to the right page. And I will, from there, take Q&A.
Question. Now that some of us are being told to get ready to return to work in office buildings, how can we ensure safety in addition to masks and gloves?
So let me let me just say this. If you're being asked to return back to work in an office setting, I would actually have a conversation with your doctor about getting a note actually saying that you're at too high of a risk to go back to an office setting. That's actually what I would do. It is very difficult in an office setting to actually be able to really keep yourself safe. I mean, the gloves and the mask are important. I would say the other thing is to make sure that you don't have that your space is your space. You're not sharing it with anybody. But if I was in a situation where I had to actually go back to work, I would get a note from my doctor, and I would actually, because if you have even one risk factor, you could actually use that as a way to actually have special considerations being given to you, and I would actually do that.
Okay, next question. There's been new information about young people having strokes and amputations and blood clotting. It all sounds stressful. Any preparation?
Yeah, yeah, I know there was someone who was a Broadway actor who has a blood clot and had to have his leg amputated. Again, the main thing is to actually really do everything you can not to come in contact with this disease. So, you know, once you actually contract the disease, how it actually clinically presents in your setting, there's no rhyme or reason to that. So really the only way to actually really deal with this is just not to contract it to begin with.
Okay, next question. If you must go to the hospital, what are 3 things that I should do? Or if I need to go for other reasons, what can I do to protect myself?
Yeah, so when you go to the hospital, okay, so when you go to the hospital, we will actually give you a mask. So you will get a mask. You won't get into the emergency department without a mask. So if you hit the emergency department door and you do not have a mask, we give you one real quick. I would say the main things that you want to do is I would get dropped off so that I would not, I don't have a family member or anyone come in with you. You want to just, so that way you're the only one being actually exposed. The other thing that I think would be important is to keep your cell phone on you. And then that way, when you call to leave the emergency department, same thing, you're leaving, somebody's picking you up from outside, they are not getting out of their car and they are not coming into the emergency department. Those would be the main things you can do when you have symptoms. When you come to the emergency department or the hospital and you have symptoms that are COVID, like they put you in a negative pressure room and they'll do everything else to make sure that they're safe and you're safe.
Thank you very much for that. Okay, I want to remind people that you can enter your questions into the chat or into the Q&A. If you'd like to ask a live question, it looks like we can do a few of those as well. So please use the raise your hand function and we will come to you. All right, next question. I saw that 2 cats tested positive for COVID. I also heard that they can't pass it to humans. The information feels conflicting. What should I do about my pets?
Yeah, so the most likely thing is that, what we've seen is human beings have given COVID-19 to their pets. We haven't seen where a pet has given COVID-19 to their owner. What's important is because these are what they call zoonotic diseases. So animals have a stronger immune system to actually fight these viruses. So the animals that have contracted COVID-19, there hasn't been any report of an animal getting sick. So as an example, because there was a zookeeper at the Bronx Zoo who caught COVID-19. Well, now 8 of the tigers at the Bronx Zoo have COVID-19, but none of them are sick. So, yeah, so there's, that's kind of like, so, they had some examples as well in Hong Kong of the same thing that sort of happened, which was the animals might catch it, but they don't get sick. So.
Understood. Thank you. Next question. My COVID test came out negative. Is it safe to hug my family members now? Can I at least come out of quarantine?
Yeah. So once if you get a COVID test and your COVID test is negative, then you can come out of quarantine and go back to social distancing. I wouldn't go all the way to hugging though. Because remember, your family member didn't have a test. You had the test.
Very good. All right. I'll remind listeners again that if they'd like to ask a live question, they can use the raise your hand feature. You can also enter your question into the chat or into the Q&A. Next question. When they start opening up the economy, what will happen if the cases spike again? And how
Yep.
can I protect myself if the government isn't doing so, like in Georgia? If I have to work because the governor opened the state and I can't work from home, what should I do?
Right. So, okay, so a couple of things. So some of both in Wuhan and Singapore, they had what they call a second spike. So, and a second spike is where it's opened up a little bit too rapidly. And because it's opened up too rapidly, then the infections begin to climb again, right? So, so yes, so you can see a second wave and you can see a third wave if it's opened up too rapidly. Normally what happens is if we begin to see that, and of course we'll know because we see the patient volumes coming through the ER, if we begin to see that, then what governments have been doing is they close again. So we go through this again, right? So I would suspect someplace like Georgia, particularly because he's opening up gyms and hair salons and nail salons, which are very high contact, places. I would anticipate that you would see a second wave and that he would actually have to close again. This is really something when you're dealing with a pandemic, it really makes sense to really do things right the first time. It may be painful, but if you don't do it right the first time, then it does lengthen the whole thing out and you have to kind of go over it again and again and again. If you're in a situation where you absolutely have to go back to work, I would definitely go back with my mask and my gloves and my cleanser.
Thank you. Next question. What if someone in your house is being exposed to a loved one who has to go to work and their colleagues are not required to wear masks because they work outside? So someone in your house is exposed to someone they love who is going to work, but they're working in an environment where their mask is not required because they're outside.
Yeah, so a mask may not be required because you're outside, but that would almost be a situation where you're just working alone. If you're working with any other people outside, you should be wearing a mask. I see a lot of landscaping guys and sort of construction guys working in small groups of 4 or 5 without masks, but they should really be wearing a mask if they're working in groups of 4 or 5. For anyone who's actually out and working and then coming back home, I know what I do in my own situation because I'm out and working and I'm in a high risk environment. I make sure I take all of my clothes off, shower downstairs, take all my shoes off before I go upstairs into the main house. And I do that as a way of sort of protecting the other people that I live with.
Thank you. Okay, let me go. Went to the wrong one. As an employer, what are things I have to do to keep my employees safe?
Yeah, so as an employer, it's really, really important that, and it's going to vary based upon the type of business that you have, but it's very important to have PPE, which is a personal protective equipment for your employees, right? And so that can include the gloves, the mask, it can include the Tyvek suits, depending upon what the actual profession is. And also making sure that everyone is staying 6 feet apart. The other thing that's very important is to actually, as an employer, to actually do temperature screening when people come to work, so that way anybody who has an elevated temperature, you send them home. You send them home on a sick day, and you don't have people with temperatures actually working. So that's the other thing that is very important.
I want to remind people that they can ask questions in the chat or in the Q&A box, and also that you can be a part of our family by volunteering and checking in with us at www.askdrv.us, or follow us on Twitter or Instagram at AskDrV. Next question. Can I get COVID from going on a walk? What if I pass people running or biking who are not wearing masks?
Yeah, so this is really important. Like when people are actually on bike paths and trails and they're running and they're biking, any sort of droplets are then moving faster and further, right? So it's very important if you're on a bike trail where people are biking and running, that you have a mask on. I know for myself, one of the things that I've actually been looking at is I've been actually going on my trail earlier and earlier in the morning, so I run into fewer and fewer people, because I went on one time in the middle of the day and I was like, there's too many folks. There's too many folks, there's too many bikes. Yeah, so that actually allows the droplets or the vectors to actually move faster and further when you have people running at higher speeds or biking at higher speeds.
Thank you. All right, and so this is a follow-up question to our one of our earlier questions about the hospital. What about routine doctor's appointments that can't be done on telemedicine? Is this safe?
Yeah. Most of the physician offices are actually closed unless they're doing telemedicine. So there are a couple of things that are actually still open, and they are things like the cardiologist, but most of the regular doctor's appointments are closed. You can't, they're not taking any patients. They're not taking any patients in. So we are seeing some things in the emergency department that might normally be seen in an office setting because the offices are closed.
So this is a question that's coming to me, and that is, I have a friend who has a high-risk pregnancy, and she's very concerned about using a midwife because of her high-risk pregnancy. She's had several miscarriages in the past, but she's also terrified about going to the hospital. What can she feels like she's in between a rock and a hard place. Do you have any advice?
Yeah, so, I would say in a situation like that, she's really got to actually speak with her OBGYN doctor and get really clear on how high risk she is. And the other thing too, you can actually ask is, you can ask wherever she was intending upon delivering, what type of precautions are they taking? Some hospitals are doing temperature screening of their employees before they come to work. Some are not. Some are making sure that we have all the PPE we need. Some are rationing it and we're using it days after day after day. So I would ask them, some places are COVID testing essential hospital workers, some are not. So it certainly is the sort of thing where I would call and ask some questions, and I would be clear what the practices are at that particular hospital that I was going to deliver at, and then also be clear on how high risk I am, and then kind of make the decision for yourself personally.
Okay. Is there a role for CPAPs in the ICU?
Yeah, so we do use CPAPs in the ICU. We use CPAP and BiPAP before we put someone on a ventilator. So yes, it's a mask for those who it's a mask that goes over the person's mouth that basically, you know, forces air into them and helps to oxygenate them. And it's one of the things that we use before putting someone on a ventilator. When you put someone on a ventilator, those folks that COVID-19 patients that are on a ventilator, about 80% of them are dying. So we're trying to actually avoid putting people on a ventilator as long as possible.
Next question. We're hearing about vaccines being made quicker than usual. How close are we, and what about a treatment plan? Is there hope that by fall we'll have a treatment plan?
So yeah, so the reason why the vaccines are actually moving a lot faster is because with Ebola and SARS, they started down the route, and MERS, they started down the route of making vaccines for those diseases, and those are also coronaviruses. So that is why we're actually able to move a little bit faster, because we're leveraging some of the work that we actually used on those other pandemics, right? So they were able, because of that, to have a vaccine sort of ready that they could kind of quickly go in and not have to start with animal trials. So that's how come now we're in the phase of human trials. I think that the human trials will have the answers to the human trials right around September, October, November. And then if they look promising, then we will see it roll. Then we will see the vaccine protocol sort of rolled out.
So do those apply to U.S. vaccines? Because I know there's been a lot of information lately that other countries are further ahead in terms of their testing and protocols with vaccines, and what and how should one be looking at that as a possible solution?
Yeah, so there's an organization that works with the World Health Organization that actually brings all the countries and all the virologists and all the vaccine makers sort of together. So there's a lot of cooperation in this space that actually transcends country. The vaccine in the US is being tested in the state of Washington. That was started probably about 5 weeks ago. The vaccine in China is also being tested, and the vaccine in the UK is being tested. So there's a sharing of information when I don't know which vaccine or which country is going to have the answer first, but there's a sharing of information that occurs when we're in a pandemic, right? So for instance, just the virus and what is it, and the DNA sequence, that was given to the United States China gave that to the United States in the middle of January. So, so there's a sharing of information so that all the countries can kind of react faster.
Okay. Question, there are different strands that come out every so often. Have you heard of a new strand coming out for the fall season?
So we know that there's different strands of influenza that come out every year. We're not clear if there's different strands of this particular disease. It did seem like it got more virulent from when it left China and when it got to us, but we don't know if we don't have enough information yet now to know if they're completely different strains, or if it's the same strain and it just kind of got a little bit more powerful. So we don't know the answer to that yet.
Okay. And then Dr. V, can you talk about the possibility of a treatment plan if it is that ever, okay, so wait, let me back up, I apologize. Can you talk about the possibility of a treatment plan? Is that ever effective during a pandemic?
Yeah, so right now, the best treatment plan that we have is really the plasma therapy. You mean for once you've actually caught it. So the best that we're seeing right now is the plasma therapy. So people who are actually getting that are doing very well and getting off ventilators. That's probably the best treatment plan that we have right now. And then the second best would be that antiviral remdesivir.
Okay, and let me just check, see here. I think that is.
It looks like it cleared it
If
out.
I have any hand raises over here and anyone over here. So I think we are right at time. So yeah, I don't have any other questions at this point. Oh, wait.
All right.
I just got an entry here. Oh, nope, one's under the wire. Let's get this one in.
Okay.
Is anyone at the federal government level taking the necessary medical, legal steps to make sure that when either a treatment or later a vaccine is developed, that no one country or company can own the patent? Ooh, good question.
Oh my gosh. Oh my gosh. Oh my gosh.
We got
Good
the smart
question.
people on here tonight.
I
Good
know,
thinking.
I'm telling you, right? Oh my
That's a
gosh.
good
Y'all
question.
So the group, the international group that I was telling you about, which works with the World Health Organization, they also make sure that manufacturers are set up in different countries, one, to go to scale quickly on a vaccine, right? And part of that organization also has funding that actually offsets the cost of whatever the treatment is, right? So for instance, if you're in Africa and you need malaria medication, the malaria medication is free, right? That medication, the cost of that medication is offset by this organization that is part of or partners with the World Health Organization. And it's like a fund that all of the countries actually contribute to, right? So then that makes sure that cost will not be prohibitive when you're actually going to actually create a vaccine during a pandemic, and so that you don't actually have a problem. Usually what happens is they will award the patent to one company in each country. In each country, I think in this country it was awarded to Gilead if they actually come up with something, and then in different countries it's awarded to, you know, different companies. But you don't have a situation where it's only one company that can produce the vaccine for the entire world. So they do put precautions in place so that way we can get enough production, because for this particular virus, we're looking at having to actually vaccinate the world population.
Yeah, that's right.
Yeah.
Wow. That's big when you think about it.
Yeah, it's really big.
So we are wrapping up. We might have time for one more question. And while that's populating, let me again remind you that you can get in contact with Dr. V on Twitter or Instagram at AskDrV, or reach us on our website at www.askdrv.us. And we do have two more questions before we close. One comment is that's not an effective option, because in this country, we do pay for Malaysia medicine, maybe malaria medicine, and it's expensive.
Yeah. So what happens is that's what's set up for lesser developed countries, right? So one of the things about this country that is problematic in general, we cannot have our health insurance tied to our job. You're going to have a problem because you're not going to be able to people who actually do not have a job or do not have health insurance are going to have problems getting everything associated with this, right? So we are the only developed country in the world that does not insure all of its people. So we actually, because of that, we actually almost operate in a healthcare, like from a healthcare standpoint, we operate like an underdeveloped country because of how our healthcare system is set up. So one of the things that I hope happens as a result of all of this is that we actually enter into the 21st century with the other industrialized countries of the world.
A comment, this has been great and informative and scary at the same time.
Well, I hope it gave you information to put some things in action.
And let me see. And then along with the question around malaria, I'm curious to hear more about your work with malaria or HIV as compared to COVID, to where we are now.
Yeah, so here's my whole thing with, and this is part of the reason why I put this webinar together. COVID moves faster than anything I've ever seen. It is the fastest, it's fast moving as far as moving and jumping from country to country. It's also fast moving as far as it moves fast clinically, right? So clinically, people go from being well to being extremely sick very fast. So this particular disease, because of the speed of it, you know, that's why I actually kind of developed the seminars, because I wanted the webinars for people to actually be able to get on, get information, and figure out what they were going to do in their lives to really protect themselves and kind of come up with some consistent practices. But when you look at, you know, other illnesses and other pandemics, this one is moving very, very, very fast. And that is one of the things that I think I find to be most concerning.
Thank you for that. Well, we're at the end of our hour, and I want to once again remind people to follow us on Twitter and Instagram at AskDrV, or check out our website where we have not only the replays of these wonderful webinars, but also a lot of other great information around COVID. And you can do that at www.askdrv.us, or be a part of the team. Just sign up to volunteer. We want to make sure you're on our list. Closing words, Dr. V.
Yeah, so I want to thank everybody for coming. I think you know, all of the research and the articles for some of the studies that I actually talked about in this are on the website. And I want everybody to stay safe and do everything they need to keep their family safe. All right.
Wait, we have a hand raised.
I see a hand raised.
More minutes.
Yes.
Let me see if we can get our hand raised in before we close out. All right, Doris, if you unmute yourself, you can ask your question.
Yes, thank you. I'm calling out of Florida, and I want to know if the doctor would be available for a Zoom conference this coming Tuesday at 2 o'clock with a group of us here in Polk County, Florida, Central Florida.
Yeah, so Doris, you know, can you put your email in the chat box, and then I can send you an email?
And I am on your distribution list, so but certainly I'll put it in the chat box.
Okay, all right, yeah, and so and then I can check my schedule and just we can talk to you, and I'll let you know. Florida is another important state because you also have a governor that wants to reopen things.
Oh yes, yes.
Right, and so I think that it's really, you know, we're really looking at, like, do people value lives or money?
Yeah.
It's money, in my opinion.
Right, right, yeah,
Unfortunately,
absolutely.
I think we're there. Thank you,
Yeah.
Doris. We will make sure we get back to you and about your request if you put your email in the chat. And I think I have one up. Oh, see, now all the people have something to say. Okay, we're gonna go to Danielle Smith. Please unmute yourself and ask your question.
Hi, Dr. Valda, how are you?
Good, good.
Hi.
Did I lose her?
Yep, she went away. I've given her, you know, she can talk. She's open. Not sure. Okay, we'll try to come back to her. I'm not sure what happened. Let's go to Kevin Brown, and I'll try to get Danielle back.
Okay.
Okay, Kevin, please unmute yourself and ask your question.
Good evening, Dr. V.
Hi, question. Kevin, how are you? Yes.
I'm well, thank you. As complicated as this coronavirus is, when you're looking ahead, when we kind of get this thing in some type of control, do you see other conditions that will possibly develop, maybe not on a biological level, but maybe mentally and in terms of that. What do you think about that?
So you mean from people actually having the stay at home, from people having as a result of the stay at home orders?
Yes, yes, that,
Yeah.
and also just people just having to go through all of this,
Yeah.
as a nation, as a community.
Yeah, so there's a couple of things that we're seeing. I'm definitely seeing an uptick already in mental health. The other day, just this week when I was working, I would say about a third of my emergency department was mental health. The other thing that is problematic is you have a lot of children who are home and they didn't necessarily have a stable family environment to begin with. So school was the place where they were able to get away from the violence in their family, or they were able to get away from the drug use that was going on at home. And they're now, they don't have a way, they don't have a way out. The other thing too that we're seeing is I'm seeing an escalation on the domestic violence front. There may be an impact there. And so, yeah, those are the sorts of things that I'm actually seeing as a result of the stay-at-home orders.
Thank you, Kevin. And Danielle, your mic is open. Let's try this a second time.
Hi, can you guys hear me?
Yes.
We can. Thank you for
Hi,
your
so
patience.
I was just thinking they tell us to stay home and self-quarantine for 14 days. But what I've noticed, just watching on the different networks, individuals who do that, then by the time they go into the emergency room, which is near the end of the 14th day, they're real bad off. And a lot of them ended up on the ventilators. Should you come in and look, because it's almost like you're sitting home. Someone told me something about the first 3 to 5 days, how it deals with congestion, and then you go to the next phase when it starts going down to your lungs or your intestines. So it seems like sometimes that being home for that 2 weeks, just sitting there getting sicker prior to going in at the last minute, prior to doing something that could be more proactive. What are your thoughts on that, or what should we do?
Yeah, I don't recommend that people come I don't recommend that people come earlier, because what happens is we won't admit you. And if you didn't have COVID, let's say you were sick from some other illness, then you might catch COVID coming in to see us, right? Because we do have COVID patients in these emergency departments. So I tell people, and I recognize that the disease does move kind of fast, like you're feeling kind of well and then suddenly you're not. What I recommend is that if people are actually not feeling well, that they actually, that they're in communication, like they have family or friends that are calling them, maybe every hour and checking on them, and that they really come in when they actually feel like they're near getting into trouble. But that can sometimes be difficult to time because it does move very fast. But coming in before that is going to be problematic, because you could not have COVID and then have COVID because you came in.
All right, and we'll do one last one before we close from Deborah K. Deborah, you are allowed to talk if you unmute yourself and ask your question.
Okay, I don't have a question, just a comment. Just wanted to let Dr. V know that I was here, and that I want to thank Ms. Doris Moore-Bailey for joining us from Polk County. And we look forward to a joint relationship in moving forward to help clear up this virus.
All right.
Thank you for your support. We appreciate it.
All right. Well, I want to thank everybody for coming tonight. I appreciate you coming and getting on the webinar. It sounds like it was helpful and useful. And create an action plan and keep it in place so that you can do everything to get over this safely with yourself and your family. I want to thank everybody for coming. Thank you, and thank you, Holly.
Anytime, as always. That concludes our webinar. I'm going to end our meeting now. Stay safe and be well.